There's a deadly crisis on Portland streets, and it's always on the move.
When you're out here, it's not easy.
The latest spot for drug use, Southwest Park Avenue and Columbia Street, right across from Safeway.
I mean, it could be the grocery store, a lot of stealing going on, and people are like getting daily household needs and trading for drugs.
I'd say it's pretty severe.
As Dennis points out, one doesn't have to look far to see how the aftermath of addiction has taken over the sidewalks there.
There's a syringe right there on the ground. I mean, if you walk around this corner and walk around this block, you'll see 20, 30 different people that are, using drugs or trying to cop drugs.
We need help out here. You know what I mean? We need help.
Last month, Portland police launched a new approach to addiction by connecting drug users with outreach workers.
We're trying to kind of break that cycle now by just starting to, introduce people to service providers who can come out on the street that moment and hopefully make those connections that, convince people to go into recovery.
They've done this a total of 4 days. They have data from the first 3. In that time, police and outreach workers connected with 100 drug users. 25 wanted detox, 18 wanted treatment, and they're not currently tracking how many of them made it through those programs.
It's an exciting early stage of a pilot project. And we are intentionally going slow, not because the need isn't great, but because we need to make sure that we're actually able to help people.
There needs to be more treatment centers. There needs to be more recovery housing, support groups.
There is a line that you cross when you are an outreach worker asking people if they need help and then not being able to give it to them.
Portland police officers are not alone here. Other first responders, like those at Portland Fire and Rescue, are also taking new approaches at how to attack this deadly crisis.
And we see firsthand the significant challenges that our city is facing.
When responding to an overdose, Portland Fire can now give medication to help ease withdrawal symptoms. And if the person is willing, connect them to long-term recovery services.
We are uniquely suited to provide this alternative solution to the tragic opioid and addiction crisis.
I think it's actually a really good idea rather than just arresting people.
All right, so to be clear, under Measure 110, Portland police are still handing out citations and fines for people using drugs in public, and they're doing that way more often than they are connecting people with outreach workers. And that's because there's not enough available services for them to be doing that work all the time. So outreach workers are now calling on the state to prioritize and invest in addiction treatment services during this legislative session, which starts next week. Brittany, Tim?
All right, Blair, thank you.